Okay. Hi again, everyone. This is Dr. Ali Majid. I will continue on case-based principles. We have a 68-year-old female known to have non-valvular atrial fibrillation, type 2DM and CKD. GFR is 55. Currently, she is on metoprolol, apixaban, and metformin, scheduled for outpatient colonoscopy without biopsy. The current INR is 2.2. How would you manage her perioperative anticoagulation؟ هل راح توقف الابيكسبان 72 hours before colonoscopy؟ هل you will continue apixaban without interruption, or will you hold apixaban 72 hours before the colonoscopy and bridge with heparin, or you will hold the apixaban 72 hours before colonoscopy and you will give vitamin K 1 to 2.5 milligram orally? Well, let's see what you think. The answer is going to be continue apixaban without interruption. Why is that? What's the idea behind this question? Well, if you calculate the Has bled for this patient, you will find the result is 1. So this patient has low bleeding risk. If you calculate the CHADS, you will find no, the patient has low thrombotic risk. CHADS VASC 3 means low thrombotic risk. Now, endoscopy without biopsy or cutting, you can continue on DOAC without any interruption. And the reference here is going to be the European Heart and Rhythm Association. طيب, EHRA. طيب. So, the take home message, if you have endoscopy, لو البيشنت هتعمل endoscopy without cutting, without biopsy, then DOAC are safe to be continued. You can continue on DOAC, right? dual اللي هو direct acting oral anticoagulant. مين هم الدواك؟ dabigatran, rivaroxaban, and apixaban, right? الابيكزابان والريفاروكسابان هم factor 10 inhibitors. dabigatran هو direct thrombin inhibitor. طيب, now the perioperative management of direct acting oral anticoagulant. We will talk about it here briefly. Then we will mention the neuraxial anesthesia. Then we'll talk about heparin and factor 10. And here's a summary. Okay.